I'm Dr. Ujjwala, mentor at Study Medics. Welcome to our YouTube series where we are discussing history taking and summarizing the case for the OSCE Part 2. We always like to start with a proverb. This one says, small steps every day leads to big changes. Keep in mind, working consistently, even in a small step, build your confidence and competency. Now, this is my station where my role pair is Dr. Priyadarshini. We are going to start the station. Hello, I'm Dr. Ujjwala, one of the doctor in the Gynec clinic. May I confirm your name and age, please?
Hello, doctor. I'm Laura Daniels and I'm 50 years.
How would you like me to address you?
You can call me Laura.
Thank you, Laura. So, Laura, may I know what's bothering you?
Well, doctor, I haven't been feeling well of late. For the past 5 to 6 months, I feel that there is a lot of sweating over my face, especially when the temperatures are quite cold outside. I've been having a bit of vaginal dryness. I've been feeling low in my mood. So I'm not very sure if I'm actually going through menopause.
The symptoms, what you told me, it's look like that you are going to the perimenopausal phase, but we need to explore more from your history. Would that be okay? Can we proceed?
Yeah, yes, doctor. Why not? Please go ahead.
Yes. So lately, any problem with you said night sweat also? Is there any night sweat?
Yes, doctor. Yes, I do have.
And how frequently you get up from the sleep?
Well, probably a couple of times I need to get up.
Okay. Any joint? Do you have a joint or muscle pain?
Yes, I do have a lot of soreness over my muscles. I'm not very sure why the aches are coming.
Mhm. Any problem with the memory or concentrations?
Well, no, I'm still able to concentrate with work, but then I've been feeling a bit dull and bored and tired.
Mhm. And does it affect your quality of life?
I mean, yeah, because I'm not able to have proper sexual intercourse with my husband. I'm not able to go frequently out with my friends. So I just feel to have some kind of social inhibition that's been there for few months.
I'm sorry to hear that it has been very difficult for you. So, do you feel any like when is there any you said vaginal dryness? Have you tried any treatment so far for that?
Well, not really. This is the first time I'm visiting a doctor to understand what's happening with me.
Sure, I'll be addressing all your concern. And when was your last period?
It's been almost 10 months. I don't remember the exact date though.
Were the periods becoming following irregular before that?
Yeah, yeah, they
Before
were
it
quite
like
irregular. It was like once in 2 months, 3 months, and then it's been 10 months. I don't have my periods.
how is your mood and emotional well-being
Yes, I
during
have
that
been
time?
feeling a bit dull and depressed.
Mhm. I'm sorry to hear that, Laura. Laura, is there any like when was like? Could you tell me more? Anything? Could you tell me about any previous pregnancy you have had?
Yeah, I do have two children, both delivered normally. They are all doing good and they're settled in their life.
Mhm. And that's good to hear. And how are you on any contraceptions?
No, I'm not.
When was your last meal?
I think it should be 4 hours back.
And have you ever had any abnormal smears?
No, nothing.
And any problem like regarding your medical history, any present or past health problem like migraine?
No, nothing that I know of. Just some kind of flus and fever I do get frequently, but nothing much, doctor.
Mhm. And any personal history of breast cancer,
No, doctor, nothing.
cancer of the womb,
No, doctor.
heart problem,
No,
any
doctor.
high blood pressure or diabetes?
No, doctor.
Any family history of any blood clots or cancer?
Yeah, my mother did have, cancer of the breast, but at a very old age, at around 72.
I'm sorry to hear that, and thank you for letting me know.
Yeah.
Any, do you have any personal history of any blood clots?
Uh, no, doctor, nothing.
Any surgery before, like removal
No,
of
doctor.
ovaries or the womb?
No, doctor, nothing.
Are you taking regularly any medications or over-the-counter medications?
No, nothing.
Mhm. And just would like to know that any like, what do you do for living?
I'm a teacher.
And who do you live with?
I live with my partner.
How is it? Is it
Yeah,
supportive?
quite supportive.
Okay. And do you have any allergy to any medications?
No, doctor, nothing.
Mhm. Some social history. Do you smoke?
Well, no.
Do you drink alcohol?
Very occasionally, just as a social drinker.
Any excessive caffeine, like tea, coffee, or energy drink?
I do take a cup of coffee every day, but nothing more than that.
Mhm. Okay. And do you know your height to weight ratio?
Well, I'm 35.
Okay. Okay. So, Laura, are you feeling any recently any emotionally disturbed, like down or depressed?
Yes, I have been feeling, bad of late. I'm feeling a bit depressed about what are the things that are happening with me, but it's okay. It's
Mhm.
manageable. I feel.
Any history of any harming yourself?
No, no, never.
Any suicidal thoughts? I mean,
No, doctor. No, I don't have such thoughts.
so anything else you want me to know?
Well, no. This just these symptoms with not having periods. Few of my friends told me that it might be menopause. So it's just that I'm worried about. And also, my sexual
Yeah.
life hasn't been great. So that's another thing that I'm worried about.
Mhm. Regarding your, you said you have not tried any treatment for your vaginal dryness, like?
Yes.
Okay. Okay. So thank you for informing all your informations. Now I got a understanding of your good understanding of your symptoms. Now I'm going to discuss your case with my consultant and presenting my impression to my consultant. So thank you, Laura. And then my consultant and we will come to you and will guide you what can be done the next. Thank you.
Thank you, doctor.
So now I'm here. My patient is Laura. So my patient is Laura Daniels, 50-year-old, present with the symptoms suggestive of menopausal transition. Her last menstrual period was 10th month ago, preceded by a year of irregular cycles. She has a significant vasomotor symptoms, hot flushes, night sweat, sleep disturbances, and mood irritability due to the depression. But there is no depression or self-harm thoughts. She is sexually active, but there is a history of vaginal dryness and dyspareunia. There is no urinary symptoms or abnormal vaginal bleeding, and no personal history of cancer or blood clot. There is a family history that her mother has a breast cancer at the age of 72, and she is not on any medication, and her BMI is 35. She socially she is non-smoker but drink occasionally, and there is no excessive intake of uh, caffeine. So my impression is she is, from the history and the symptoms my patient told, it's look like she is having the late perimenopausal phase. So thank you.
Thank you, Dr. Ujjwala.
Thank you.
So, well done. It was a good station, I should say. To go back and give you the feedback, we need to understand that this case station of taking history and summarizing to your colleague, it involves the role player and the examiner. So the marking will be done both by the role player and by the examiner. Now, from the role player point of view, yes, you were quite empathetic. You introduced yourself well. You're giving kind enough, you were kind enough to give attention to all my symptoms. You were trying to check my understanding in between. And coming to some points that I would say is, when you're talking about cancers, when you're talking about sexual history, I would like you to, kind of give me a warning shot and then take it forward. This is one thing. And then coming from the examiner point of view, I should say, yes, your time management was fine. Your history taking the template was good. You started with a good introduction. You had a good agenda setting. And then you started by exploring the symptoms. You went into the last menstrual period, previous menstrual history, obstetric history, past medical, past surgical, and family histories also. And then also you had an understanding of her social histories, allergies, and her BMI. And also asking about personal histories like smoking, alcohol definitely will add on to this. Some suggestions that I would say: when you are in the seat of the candidate, you might get a bit nervous and you might miss on some important points. So it is a good idea or a good practice, I would say, to have one summary to the role player also, just to ask her understanding and see, well, I understand, Miss Laura, it is with these symptoms you have come to me. Is there anything else that you would like to add on? This particular line will give the role player a second chance for to express her concerns if anything was missed, particularly from what you have asked her. And after that, you can summarize to the examiner. The summary was fine. You started with the basic introduction of the case, and then you summarized all the positive points. And probably you could give a provisional diagnosis saying that these are some perimenopausal changes. She need to wait for another 2 months to confirm whether it has gone into menopause. That's just an add-on remark from the examiner point of view. Overall, I should say it was a very good presentation. Over to you, doctor.
Thank you, Dr. Priyadarshini. Thank you.
Yeah, you can go ahead with the marking system.
So for the marking system for the role play, it is out of 20. The 10 marks is for the content of the history, where the examiner will observe you, how you present yours, how you introduce yourself, how you collect the history, gather the history, menopausal symptoms history, then how you follow the formats, and then you present yourself in a SBAR format to the consultant. 5 marks is for the communication for the examiner, which focus on the rapport, clear explanation, logical sequence, and concise summary. The last 5 marks is for the communication for the patient actors, where she will address you on the will observe on the professional listening, how you are listening to the role player, giving the easy to understand language, encouraging questions, and autonomy and belief to be respected. The overall the impressions comes from the examiner as pass, borderline, and fail. So this is the marking system for the role player. Thank you.
Yeah, so this is the examiner marking system. This is what exactly the examiner is going to follow. And for the role player, again, role player will be looking into the points that Dr. Ujjwala was saying, how trustworthy and how reliable the doctor is, how safe the doctor is, everything will be looked into. Would you like to give them a brief about the template?
Yes. So this is a history template where you always start with the history of present illness. Ask what she has, like in the menopausal history. You should ask the hot flushes, sleepless nights, night sweat, low mood swing, and they're feeling anxious, any joint and muscle pain, any loss of memory and concentration. Then you start with an open-ended questions like, let her speak. And then slowly you can reassure her, address her concern, then ask the menstrual history, then sexual history. Always signpost first and then move with the sexual history. Then you go with the obstetric history, the medical in sexual history. At the later part, you can cover the gynec history, like the when was her smears, is she using any contraception? So there you can cover up the gynec history also. Then obstetric medical history, you can ask what are the, like, these are the very important symptoms: a personal and personal history of breast cancer, cancer of the uterus, and then current health problem like migraine, heart disease, diabetes, on the family history of any blood clots and cancer, surgical history, whether she is hysterectomized or not, drug history, you need to, this is also very important, and the social history, you will ask her BMI, smokes, alcohol, any excessive amount of caffeine, and any mental health depression, such as mental health questionnaires like depression or self-harm. So this is the history template ideally everyone should follow. Thank you.